Hello, and welcome to the Total Shoulder Replacement Education course. We wanted to take this time to thank you for partnering with us in your educational journey to prepare you for a positive experience and outcome. There will be several sections discussed in this video, including introducing you to your healthcare team, preparing your body for surgery, a beforehand surgery checklist, what to expect on the day of surgery, your recovery at home, and an overview of post-surgical therapy and exercises. Let's get started. Our Orthopedic Wellness Program. At Providence Sacred Heart and Holy Family Hospitals, we have a diverse team of surgeons who utilize evidence-based practices to both reduce complications after surgery while promoting the most optimal outcomes for each patient. Some of these practices may differ slightly from surgeon to surgeon, but each are patient-focused and aim to provide the highest quality of care and patient satisfaction. Most of our total joint procedures are done as outpatient, which means patients go home the day of surgery or the following morning. This decision is made in partnership with the surgeon based on several factors to ensure the best surgical plan is made for each patient. This requires open, honest communication and participation in the healthcare journey to ensure the optimal plan and outcome for you. Here is an introduction to your healthcare team. The orthopedic surgeon is the person who performs your joint replacement procedure. You should have already met your surgeon either in your new patient appointment or in your pre-operative examination. Many of our orthopedic surgeons work with physician assistants who will also see you for pre-op examination appointments, post-surgical appointments, and assist your surgeon in the operating room during your procedure. An anesthesiologist and certified registered nurse anesthetist are the practitioners who keep you comfortable during your procedure. They will assess your vital signs and make sure to give you any medications needed throughout your procedure. Some patients may see a hospitalist, which is a physician who helps manage any medical issues that could impact you during your hospital stay. You will meet many registered nurses while you are in the hospital. First, there will be a nurse who helps prepare you for your surgery. He or she will ensure that you have all tests and documentation completed prior to going to the operating room. Next, you will meet the operating room registered nurse. He or she will ask you questions about your procedure to verify the correct information and accompany you and advocate for you while you are asleep during your procedure. You will also have a registered nurse care for you in the recovery room once your procedure is finished. You might have a nurse technician who is working alongside the registered nurse who can assist with personal care and some nursing procedures. There will also be a certified nursing assistant who will also help get you ready for your procedure, assist with vital signs, and help to get you out of bed safely. After your procedure, you might see an occupational therapist. This person works with you to ensure you can complete activities such as bathing, eating, and dressing. He or she will also work with you on range of motion exercises and teach you how to put on and take off your sling. If needed, a physical therapist is available to help you with your mobility. The hospital also has respiratory therapists available to monitor and assist you after your surgery to help optimize your breathing if needed. Social workers and case managers are also available to work with your care team and assess any needs that arise after your procedure and help make decisions that are the safest for you once you are ready to discharge. A dietitian is available to visit you during your hospital stay if needs arise regarding any nutrition. There are also caregivers available to provide emotional and spiritual support if needed. Next, let's discuss preparing your body for surgery. Your health and safety are our top priorities. Our goal is to provide you with the best outcome following your procedure, and that starts with keeping you healthy beforehand. We have protocols in place to ensure the safety of our patients and caregivers in our facilities. Every patient who is scheduled for surgery will be required to provide evidence of a negative COVID-19 test that was taken 3 to 5 days prior to your procedure. If you haven't received information on COVID-19 testing and where to complete this, please reach out to your surgeon's office. It is important that you quarantine at home as much as possible between the time of testing and your procedure to minimize any exposure to infections. Currently, all surgical patients are allowed one support person to accompany them to the hospital. Our goal is to help you have the best possible outcome after surgery. If you use nicotine products, we ask that you stop at least 6 weeks prior to your surgery. Smoking can lead to decreased healing and may increase your chance of a postoperative infection. If you drink alcohol, limit the amount as much as possible before your surgery. Be honest with your surgeon and care team about any substances that you use so we can take the best care of you. Optimizing your physical health will prepare you for a positive outcome. Stay as active as you can, eat healthy and nutritious foods high in fiber and calcium to promote bone health. You will need to have a preoperative examination either by your primary care physician or our pre-admit clinic. You might also need to receive clearance from a specialist who will order any necessary testing to ensure you are ready for surgery. It is necessary that you check with your prescribing physician if it is safe to continue taking your medications as prescribed or when you should stop them before your surgery. Aspirin and ibuprofen products will need to be stopped before your surgery, so please be sure to check with your surgeon on when to stop. Any blood thinners you are taking will also need to be stopped prior to surgery. You will need to consult with your anticoagulation doctor to direct you when to stop based on your therapy goals. Be sure to inform your surgeon about all medications that you take, including any over-the-counter drugs, herbal or nutritional supplements, CBD products, and fish oil. These may also need to be stopped before your surgery. Routine health maintenance. Some surgeons will require that you obtain clearance from your dentist prior to surgery. Be sure to avoid all non-emergent dental work, including routine cleanings, 3 months prior to and 3 months after your surgical procedure. If you are having any dental emergencies or problems with your mouth or teeth, be sure to inform your surgeon's office right away. Avoid any routine care such as colonoscopies, cystoscopies, or biopsies if possible up to 3 months before your surgery. If you are prescribed antibiotics for an infection of any kind, be sure to let your surgeon know. Joint injections. Avoid any injections into the joint where you are having surgery at least 12 weeks before, if not longer. Please consult your surgeon for their recommendation on how long after an injection to wait for your surgery. You should receive a CHG shower kit in the mail before your surgery. If you do not receive one, let your surgeon's office know and they should be able to provide you with one. You will need to use the special soap for 2 showers, one the night before and one the morning of surgery. Be sure to use a clean washcloth and a clean towel each time. Follow the instructions in your kit for the systematic wash, starting with the clean cloth scrubbing at least 1 minute to your incision site and working from the neck down to your toes. Be sure to avoid your genitals and face with the soap. Make sure to also clean your belly button between your toes and your feet. After your nighttime shower, ensure that you have clean sheets on your bed and clean pajamas. Avoid allowing pets to sleep in bed with you after your shower. Repeat this wash the morning of surgery and ensure you have clean, comfortable, loose-fitting clothing that can easily be taken off and put back on. Do not use any lotions or face creams, hair products, makeup, or deodorant. Make sure to remove all jewelry and piercings, including wedding rings, and leave them at home. This is important for 2 reasons. Your surgical team will not allow any jewelry on during the procedure, as fingers and toes may swell, causing increased pressure from your rings. There is also the use of electrocautery during your procedure and can put you at risk for a burn from your jewelry. If the jewelry must be removed at the hospital, we want to make sure it does not get misplaced, so we ask that you keep everything at home. No shaving the surgical area for 7 days prior to your procedure, and men should avoid shaving their face the morning of surgery. Next, we will discuss the before surgery checklists. It is important that you monitor your skin integrity closely before surgery. You will need to inform your surgeon's office if you develop any rashes, infections, or open sores anywhere on your body that might put you at an increased risk of a surgical site infection. Also, any scratches or abrasions directly to your surgical site will need to be checked by your surgeon to make sure you are safe to proceed with surgery. Any paperwork that is needed for work release or disability will need to be fully completed and turned into your surgeon well before your surgery date to ensure timely completion for you. We also encourage that you have an advance directive on file with the hospital. This is also known as a living will and is a document that specifies what action should be taken for your health if you are no longer able to make decisions for yourself. If you already have an advance directive, make sure to bring it with you when you check in for surgery so we can have a copy in your chart. If you do not have one, Providence has staff that can help you complete one if you are interested. An important part of your recovery at home is designating a caregiver or support person who is available to stay with you for the first 5 to 7 days. You will need someone who is able to help you around the house and ensure you are safe getting back to your daily activities. You will also need to make arrangements for a ride to and from the hospital for your surgery. This will likely be with your support person or caregiver, but can also be another friend or family member who is able to get you safely home following your procedure. Make sure that you get any needed home assistive devices before your surgery so they are ready once you get home. If you are able to get your sling ahead of time, whether at your pre-op appointment or at prehab, make sure you bring that with you to the hospital on the day of surgery so it can be properly fitted before you go home. It is highly recommended that you have a person designated to stay with you once you discharge home. If you live alone, reach out to friends and family members who may be able to come stay with you for a few days while you recover until you can safely be home by yourself. When you are alone, make sure you set up a communication plan with a trusted person who can come check on you daily or you can reach out to if you need any help. If you do live alone, preparing as much as you can before surgery is important. Have all of your laundry and household chores completed beforehand, and make sure that you have someone who can help with any yard work if you are unable to do so yourself. Do grocery shopping ahead of time and prepare easy meals that can be frozen and reheated. This way you can make sure you have plenty of nutrition available with little help needed. You will not be cleared to drive for several weeks following your surgery. Make sure you set up transportation to and from your therapy and post-op appointments until your surgeon tells you you are safe to drive. There are many appointments that need to be completed before your surgery. Based on your individual health history, you may need to receive clearance from your primary care doctor and any specialists that you see that manage any health conditions you have. You might receive a call to set up an appointment with our pre-admit clinic, who does a thorough pre-op examination and orders pre-op lab work to ensure you are safe to proceed with surgery. You will also receive phone calls from our pre-surgical screening department and registration office to go over information needed for your hospital account and medical chart before you check in for surgery. Your surgeon might require you to have a prehab visit with our physical therapy team. The goals of this visit are to teach you post-operative range of motion exercises, ways to help manage swelling in your arm after surgery, teach you how to perform daily activities with your non-surgical arm, and how to put on and take off your sling. You might receive a sling during your prehab appointment, and it will be properly fitted and adjusted for you. Please make sure to bring it with you to the hospital to be put on following your procedure. Our main goal is to get you home safely as soon as possible. We want to make sure you and your care coach are well prepared and educated on what you need when you get home. Make sure to bring your sling with you to the hospital, as well as your advance directive if you have one. Our surgical team will review all of your medications and make sure you have an accurate list with dosing instructions for any new medications before you go home. You will want to make sure your care coach is able to pick up your prescriptions while you are in surgery to make sure they are ready for you when you go home. Make sure you have all of your post-op appointments made before the day of surgery to ensure a smooth transition once you are discharged. Here are some things that you can expect on the day of surgery. On the day of surgery, there are several things you will want to bring with you to the hospital. First, a list of your medications, dosages, and frequency taken. This includes all prescriptions, over-the-counter medications, vitamins, and supplements that you take. Please do not bring any medications or bottles to the hospital. Simply a typed or written list with this information is all that is needed. Make sure you have a note of any medication or topical allergies or sensitivities that you have, including any certain tape, latex, or a shellfish and iodine allergy. If you have a CPAP machine for sleep apnea, be sure to bring this with you to the hospital. It might be utilized to assist you while you are waking up following your procedure. Bring a copy of your advance directive or living will if you have one, so that it can be scanned into your chart. In case you stay the night, be sure to bring any toiletries, reading material, or anything else that will make you comfortable at the hospital. If you wear glasses, contacts, dentures, or hearing aids, make sure to bring those with you if needed, and the cases for storage. Be sure to bring your sling if you were given one beforehand at a prehab or pre-op appointment. Make sure you wear comfortable, loose-fitting clothing that is easy to get off and sturdy non-skid shoes for safety. Assure that you have your support person and ride lined up and ready to take you to the hospital for your check-in time. When you get to the hospital, report to the pre-admission check-in area for your procedure. You will be checked in and asked for some admitting data. Then you will be brought back to the surgical admit unit to prepare you for your procedure. You might get some pre-op testing done if needed, and you will have a CHG wipe down of your body before you head back. You will be greeted by a nurse in the pre-op area, your operating room nurse, an anesthesiologist and CRNA, and your surgeon. The team will ask you many similar questions to make certain that we have the correct patient and the correct procedure to ensure your safety. All documents will be signed and loaded into your chart. Then you will be taken to the operating room. Next, we will discuss what you can expect after your surgery. After your surgery is completed, you will go to the post-anesthesia recovery room. Here the team will monitor your vital signs, assess your pain level, and give you any medications needed. Your intake and output will be monitored and your dressing will be checked to ensure it remains dry and intact. Most patients go home this day, so you will be transferred back to the unit where you checked in to prepare for discharge. If you are not going to discharge until the next morning, you may be transferred to the orthopedic unit. As you continue to recover, you will be encouraged to sit up and mobilize as soon as you are able to. When you are ready, change into your comfortable clothing and sit up in a chair to eat and drink. If any further planning is needed for your discharge, you might be visited by our case management or social work team. Be sure to communicate your needs to your care team so that they can take the best care of you. We want to ensure your pain is at a level that is tolerable for you. This might be a little different for everyone, so communication is key. If you feel you need pain medication, be sure to ask your care team. There are also other methods you can do to keep your pain at a tolerable level in addition to your medication. Icing and elevating your surgical arm is important. Make sure you are rotating icing on and off every 20 minutes or so to get the greatest effect. Reposition yourself as often as needed to stay comfortable. Breathing techniques, meditation, and distraction tools are also good ways to help manage pain. After joint replacement surgery, you are at a higher risk for developing a blood clot. There are a few ways that your care team will help prevent this from happening. You will have sequential compression devices, or SCDs, placed on your calves during and after surgery. These are sleeves that periodically squeeze and release pressure to your legs, which will feel much like a massage. This will help prevent blood clots in your legs while you are laying down for an extended period of time. There are also things you can do to help prevent blood clots. Frequently getting up and moving around, coughing and deep breathing will also help. Make sure to always participate with your therapist, getting up and moving as directed if your surgeon recommends it. If you were on any blood thinning medication prior to surgery, your prescribing doctor will let you know when it is safe to restart that medication afterward. Much of the preparation for you to go home begins before your surgery. Make sure to get any equipment or exercise tools recommended to you beforehand and set up any post-op appointments with your surgeon or for therapy if it is recommended. Make sure you have a caregiver identified that can drive you to and from your surgery and help you around the house for a few days. Be sure to have your caregiver obtain all needed medications you will need once you are home. Make sure you have clean, comfortable clothing that is easy to put on, such as a button-down shirt. Also, wear easy to put on shoes that have a non-slip sole for your safety. You will be discharged as soon as you are cleared by your care team. Your pain is well controlled, and you are safe and comfortable to leave the hospital. In order for you to be able to discharge home safely, there are some criteria that must be met. First, your surgeon will give you the okay that you are cleared to leave the hospital. If therapy is recommended, your therapist will also evaluate and clear you for discharge. Your pain will be well controlled using oral medications, and you will demonstrate understanding of any new medications that you are prescribed. You will be able to demonstrate independence with your mobility and have sufficient help at home for your safety. You will have arrangements made ahead of time, such as any medical equipment needed or follow-up appointments made. Finally, you will have a reliable vehicle and a person present to take you home. Your recovery at home. Once you are home, it is important that you keep your sling on at all times, as directed. To put on your sling, put the strap over your neck first and then slide it onto your arm. Secure it across your waist and ensure that the straps are tight but comfortable, and you should not feel any pinching or binding when it is placed correctly. Make sure your arm stays close to your body and your elbow is bent at a 90-degree angle. Your surgeon will give you instructions for when it is okay to remove your sling and any restrictions you have while it is off. Usually, you may remove it to shower and to change your clothes. If your surgeon okays it, you can remove your sling to take a shower. Carefully remove your sling while keeping your elbow at a 90-degree angle and try to protect it from moving as much as possible when you're in the shower. Most patients can shower as soon as they are feeling up to it, but make sure you never submerge your operative shoulder in water such as a bathtub, pool, or hot tub until your incision is fully healed and your surgeon clears you to do so. It is important to wait until you are ready for showering and that you feel strong enough to stand for at least 10 minutes at a time. You can also purchase and use a shower chair or bench to sit while you shower. Sponge baths are very effective until you are ready to stand up in the shower. A tip for washing your armpit while showering is to lean over and let your arm fall away from your body and use your non-surgical arm to clean. Make sure to wash your armpit last and never go back over your incision site afterward. A common side effect of surgery and pain medication is constipation. You will likely be prescribed a stool softener after surgery, or you can pick it up over the counter. Make sure you take this daily as prescribed until you are having regular bowel movements and you have stopped taking your pain medication. Do not wait until you are constipated to start taking the stool softeners, as it might be too late at that point. Nutrition and movement are also great ways to prevent constipation. Make sure you are drinking at least 6 to 8 glasses of water daily, eating high fibrous foods such as fruits, green leafy vegetables, and whole grains. If you have not had a bowel movement within 2 to 3 days after you get home, please reach out to your surgeon's office to try other methods to relieve your constipation. It is important to know that you will feel pain after surgery. The goal is to keep the pain at a level that is tolerable for you to still go about your daily life. Pain control after surgery is a multimodal approach, which means there are many things that you can do to help. It is important to take medications on a regular schedule to stay ahead of the pain. Do not wait until you are feeling increased pain to take the medication. Icing your affected arm many times throughout the day will also provide a pain-relieving effect as well as decrease any swelling you may be experiencing. If your surgeon recommends therapy for you after your surgery, it is important to take medication for pain beforehand, as the exercises and movement will likely increase your pain level. Resting and elevating your arm are other good methods to aid in pain management while you recover. It is important to recognize what are normal symptoms after surgery and which symptoms might need to be reported to your surgeon. As mentioned before, a tolerable level of pain is to be expected. Minimal swelling, mild pain at your incision site, and bruising of your surgical arm are also normal afterward. Some symptoms that should be addressed through your surgeon's office include pain that is getting worse after all pain-relieving methods have been tried, throbbing or cramping pain or swelling in your leg or arm that is not related to your incision and could potentially be warm to the touch, any shaking, chills, or a temperature over 101 degrees, swelling or redness around your incision site that is worsening, increased fluid drainage from your surgical site, or a feeling of loosening or instability in your operative shoulder are all symptoms that you should report to your surgeon's office right away. Your surgeon's office can help manage many symptoms you might experience after surgery, but it is important to know when you need emergency help. If you are having any symptoms of a stroke, chest pain, shortness of breath, difficulty speaking, any sudden loss of function or numbness, or any other life-threatening emergency, you need to call 911 right away for help. Here is what to expect during your post-surgery therapy. Depending on your individual surgery, some surgeons will have you start therapy right after surgery or wait until you are cleared after a certain amount of time has passed. A therapist will help you regain your independence of performing daily activities through range of motion and strength training exercises of your operative shoulder. If therapy is recommended in the hospital, your therapist will work with your nursing team to schedule your therapy times and ensure a clear plan that prepares you for discharge. Never say no to a therapy session if you can participate, and expect that you might feel some fatigue and pain after your surgery. If you are experiencing fatigue, dizziness, or pain during your therapy sessions, sometimes there are modifications that can be made, such as sitting in a chair for your exercises, that can make you more comfortable. In the following slides, we will demonstrate some important exercises for you to perform after surgery. We recommend that you practice these ahead of time to familiarize yourself with the movements. While you are in a sling, it will be important to continue to move your hand and wrist. Please check with your surgeon for your individualized exercise precautions or restrictions after surgery. The following clips show you how to perform some of these exercises.
In this video, we are going to demonstrate pendulum exercises. First, find a supported base. Bend your opposite leg and propel your arm backwards and forwards. Make sure to relax your shoulder and use the momentum of your body. Next, you can move your arm in a circular motion. We are going to show you what not to do. You do not want to actively lift your arm. Keep your shoulder relaxed at all times. Let your body move the arm. And that is how you do pendulum exercises. We are going to demonstrate forward elevation while supine, which means laying flat on your back. We are going to show you the full range of motion. Next, we are going to show you 140 degrees forward elevation. Let's start with full. She is doing active assist range of motion, utilizing her other hand that's not affected to achieve full range of motion. Next, we are going to demonstrate forward elevation to 140 degrees. Again, using our unaffected arm to assist with range of motion. This video, we are going to demonstrate how to do full range of motion, active assisted external rotation using any household device. Next, we are going to demonstrate external rotation active assisted to 40 degrees. This video, we are going to demonstrate passive internal rotation with using household device and a pillowcase to help guide her arm back and forth. This is full range of motion, passive internal rotation. In this video, we are going to demonstrate wall climbs. This exercise increases flexion, range of motion.
Thank you for completing this important educational video for your total shoulder replacement surgery. If you have any questions following this video, please contact me. My name is Laura Waters and I'm the Total Joint Program Manager for Providence Inland, Northwest Washington. Once again, we look forward to helping you during your surgical journey.